in the early days of AI, there was a general acknowledgement that machines can do a lot, but they will never understand emotion or
Mhm.
empathy.
Mhm.
And one of the first use cases of ChatGPT by doctors
Mhm.
was to give empathetic messages to their patients
Mhm.
because doctors were so overburdened and so overstressed that they didn't have time to phrase
Exactly.
themselves correctly. And that's why they asked ChatGPT to write an answer that they could give to their patients.
Mhm.
Um, so it seems so counterintuitive 10 years ago to what is actually happening.
Mhm. Mhm. Mhm.
The interesting thing, or the dimension that I will add on to it, though, is that I agree that in most cases they produce excellent output. At least individual answers are always going to be excellent.
Mhm.
When it comes to the entire care trajectory,
Mhm.
I would say they will always beat the average therapist, in my view.
Mhm.
Looking at the coming years, we are consistently going to beat the average therapist.
Hello, everyone, and welcome to another episode of the Intelligent Future podcast. In today's podcast, my guest is Umar Nizamani, who is the founder of Inquira Health, which is a conversational AI platform that helps clients book appointments with their healthcare clinic. This platform is highly useful as it reduces this managerial overhead, but also helps in reducing no-show up issues or the canceling of appointments. Not only did we talk about that, but we also touched on other areas where AI can help, for instance, therapy and other aspects of healthcare. This was a very practical episode, and I hope that you will enjoy it. Omar, welcome to the Intelligent Future podcast.
Thanks for having me. I mean,
Okay, so Omar, tell the audience a little bit about your background. I think you probably a graduate of computer science, bachelor's degree or master's degree, but you also are an entrepreneur in AI and IT in the healthcare field. So tell us how you got there and a little bit about your background.
yeah, for sure. I do have a slightly alternative storyline because I didn't finish my degree. I started coding when I was 11, just as a kid who got obsessed with how games are made. And as a kid, if you get obsessed about a problem, you have so much time on your hands that you end up getting really good at it. So by the time I was 17, I'd already started my first company back in Pakistan. That's where I'm originally from, doing mobile games. And in that era, I learned a lot how to engineer mobile games for Symbian phones. These are before Android and iPhone. So if you're obsessed about certain problems and you just have so much time to go deeper into it, what ends up happening is that there's just so much to learn. You go in games from how the brain comprehends visual signals, audio signals, so that you can have like a very immersive experience, to how do you make it enumerate like really fast on very ancient architecture. I mean, the mobile phones back then didn't even do floating point maths. Doing multiplication on decimal figures was too slow. You had to hack around everything. Um, that's basically how I got started into it, just obsessed about how games are made. And over the last, I would say now I'm 35. So over the last 24 years, it's just been engineering in basically every sense of the domain. Um, and I think on the entrepreneurial side, what was very lucky is that as I started the company at 17, I had a mentor with me, a co-founder, and he also helped me a lot to understand the entrepreneurial side, to learn how to build businesses. And having built that company for 8 years, and then almost 8 to 10 years, and then moving to the Netherlands, where I built a mental health company for 8 to 10 years, you really get to learn how to think on it beyond just the technical scope. You start realizing what does the business need? What's the value behind it? And how do I ensure that I can sustainably build towards this future that I see? Um,
Fantastic. What a great journey. I'm always fascinated by how my guests build their career from early on curiosity all the way to entrepreneurship or great positions where they are. But why mental health care? What made you interested, or healthcare in general? What made you interested in that?
Yeah, so that was actually not something that went into consciously. I
Hmm.
think the conscious choice for me after I was leaving Pakistan was that I had significant technical skills.
Hmm.
So I knew I could deploy my technical skills all across. And coming from a lower middle class family
Hmm.
and having strong moral values, for me, I knew I wanted to do something that had a societal purpose, a strong societal impact. And in that hunt of like looking around what opportunities there is social first and technically challenging. I came across a company in Rotterdam, Netherlands, which was focused on mental health care. At that time, they were doing projects for employee well-being, and then I had a dedicated app for mental health. And within a year of me joining as an engineer in this company, me and the CEO had a great click. And that's why I became the CTO of the company, which is something I scaled for 6 years. And eventually I became the CEO international of the same company. So taking the same company from the Netherlands and bringing it across the world. And what happened in this journey is that the healthcare is a bug that bites you. Once you start working on something so purposeful, and
Hmm.
then you go out and you have conversation with patients and who are really suffering and really want to help themselves, but are struggling to find the right resources. And then you see the impact you can bring to them. That is extremely transformative. It really gives a meaning to your life. Um, this enterprise that I helped build, basically, we ended up doing over 100,000 treatments with my previous mental health application. And I would say this is the biggest achievement of my life to date. Doing complicated tech is something I love, but all of that in comparison to this human impact doesn't. There's no comparison to it. Like 100,000 people having any impact to have their life outcomes improved is just so fulfilling, and that's why after like building that company and attempting or thinking to do something else in the middle, I just jumped back to healthcare. It's just the purpose is too great there.
Wonderful. I'm fascinated by that. I want to go back to the mental health care app that you built. If you could tell the audience a little bit, you said it's along the lines of digital well-being. If you could tell the audience a little bit about what this app does for people. Is it for people with mental health issues or for everyone, anyone who wants mental resilience, for instance?
Great. Yeah, this is something that after doing tons of interviews and also the key offering that we've built um, makes digital treatment to be much more effective.
Mhm.
So our fundamental objective was to make the therapist much more efficient and effective than they can be without this app or without support. The way we went about doing this is that when we were even starting to build this core product, we sat down with researchers and psychologists, and we said, okay, we know certain treatments work better, and certain treatments don't. So, what are the core elements that make care actually better? So we started from the science first instead of, oh, I have a tech, let's just plug it into whatever problem we found. And the benefit of this approach was that after doing tons of interviews and talking to so many psychologists and patients, we realized there are some fundamental truths. Um, Example is that patient empowerment. So in mental health, if during the treatment, if a patient is empowered to take ownership of the care process, then the care outcomes are generally better. This is something we have tons of literature for. So if
Mhm.
people feel they're part of the treatment will have much higher
Can
effectiveness.
I stop
Uh,
you there? Tell us a little bit about what that means for the audience. So, for instance, you're saying empowerment is very important. What does it mean? Does it mean that the patient, for instance, is active in their treatment? Tell us a little bit more.
exactly. That's as you said, they have to be active in the treatment. So what this in practice means is that you can't show up to the therapist and expect all the words they say, like a parent, they guide you, and that is the end of the care process. That doesn't work because then you are really offloading your problem on someone else. It will have help, it will have value. So don't get me wrong, just listening to the therapist is useful. But the moment you participate in the care process itself, that means your mental health is in your hand, and the
Mhm.
therapist is just guiding you how to use your tools better,
Mhm.
then the outcomes are much higher.
Mhm.
And this means that instead of every time the therapist says to write two sentences, you write them.
Mhm.
Instead of this mindset, you go into the mindset of, oh, I can write down in my diary and reflect whenever I am feeling in moments of crisis in my life.
Mhm.
There is a difference in a thought process now.
Mhm.
On one side, it was a task given to you by someone else. And on the other side, you have a tool in your hand that you can use whenever.
Mhm. Mhm.
Um, this difference results in extremely effective care.
That is very
Uh,
fascinating. Oh, sorry, go ahead.
and this is exactly why, like, knowing that these were the fundamentals, we decided to build a remote patient monitoring tool where the therapist can monitor your outcomes.
Mhm.
But on the other side, empower patients with tools to write in their diary, register emotions,
Mhm.
register substance abuse, and actually take ownership of their care process. And
Mhm.
every time there were like moments of inflection, the therapist could come in and give chat messages or do online calling and provide remote treatment as well. And once this goes hand in hand, then the outcomes are significantly better.
Wonderful, fantastic. I'm just curious because you mentioned as a child, you had a background or an interest in gaming. Did that have any role to play in designing or building a mental health care app? By that I mean, as humans, I think we are encouraged and energized when we see results. So maybe you've engineered a little bit of that in the app, like I'm seeing that I'm getting better. I'm seeing that I'm becoming more mentally resilient. My confidence is getting, things of like this kind of feedback that can be really helpful.
Yeah, you're on spot. This is why there is generally a higher percentage of especially well-being and lifestyle apps. That
Mhm.
means mental health issues that are not severe or not diagnosed. At
Mhm.
that stage, we prefer to gamify elements to
Mhm.
make things much more intuitive and interactive.
Mhm.
And this is a very a significant impact in nudging user behavior.
Mhm.
Actually, one of the let's say one of the most powerful apps in the world that nudges you into behavior change is Duolingo,
Mhm.
the language learning app.
Mhm.
It's used by hundreds of millions of people,
Correct.
and they're trying to do something that's very hard, learning a new language, which
Yes.
requires you to rewire your brain.
Mhm.
And the way they've done it with tons of like streaks and habits and nudges and like all these elements, these are the gamified elements that you tend to use all across when you want to change behavior.
Fantastic. Let me ask you a little bit about the personalization of the mental health app that you created. Humans are different, and without recognizing that fact, I think some applications unfortunately fail. And there is tons of research on how personalization leads to usage. So, is that something that you take into consideration? For instance, maybe I'm someone who doesn't like so many nudges, right? So you're forcing me to deal with these things that will put me off. Like, have you looked into personalization?
No, definitely. It's something, funny enough, we have done it on two angles. So
Mhm.
before building the core product, my last core product, which was Nice Day,
Mhm.
we used to have another app, which was AI assisted mental health coaching.
Mhm.
Again, for diagnosed people,
Mhm.
but then 100% through our machine learning algorithms that ran on the phone to
Mhm.
detect your behavior and give you, for example, it would detect when you went for a walk or a run
Mhm.
and then give you a positive reinforcement just after you came back saying, great job that you
Wonderful.
planned a run and then you went for it.
Mhm.
So we try to use a ton of science to nudge you in the right direction, knowing your task list.
Mhm.
But one thing that I've learned having built it in AI first manner in the past, and then later on with Nice Day, which is like therapist assisted,
Mhm.
is that the biggest learning is that humans don't listen to AI.
Hmm.
People listen to people.
Okay.
It's just fundamentally AI can help you if you configure it
Hmm.
that I want to change my life and I want to ensure that if XYZ happens, then I need a reminder for something.
Hmm.
Once you are in control and you tell the machine that I want reminders and nudges in certain categories, then those reminders are extremely effective.
Yes.
But when you don't configure them, then they're generally noise.
Yes.
And
Yes.
a much stronger leverage that you have there is accountability.
Hmm.
If there is someone with you, even if you like don't ask them to nudge you or remind you of it, but if they just ask you, so did you end up going to the gym this week? That question alone nudges you into behavior change. So we are a much stronger social being than you would like to admit. There's a lot of subtleties here where I'll have to say clinical psychologists or generally, let's say, yeah, cognitive scientists do a much stronger job of, and try to learn as much as I can from them on this domain.
Absolutely. Absolutely. Uh, I'm interested in the social piece. So you said that we are motivated more socially than, let's say, systematically or by using AI algorithms. How did you? I think you just gave an example of how you incorporated it, but if you could dwell on that a little bit, on how you incorporated the human social behavior into the engineering of mental health app.
Yeah, this is so the one of the most powerful realization for me is this social aspect of it.
Hmm.
And the reason I believe this is very fundamental, especially from a first principle standpoint, is that now instead of my earlier naive mindset used to say, let's make AI systems that take over everything. And the my learnings have taught me, let's make AI system that make one human to be 10 times more efficient, or maybe 100 times more efficient. But the human stays in the loop.
Hmm.
And this requires a fundamentally different way of engineering things and thinking about deep problems. Because the way we were building it in Nice Day is that instead of building AI systems that steer your therapy or do things automatically, what we started doing was with one click of a therapist, they could steer 100 people towards better social change. So it's the same problem. We just change the mindset from automation that is completely automated without human intervention to
Hmm.
human guided and human controlled. And that I feel had a much stronger outcomes.
100%. In the past, I think prior to the Gen AI era, companies like Amazon, Netflix, engineered recommender systems, for movies, books, things of that nature, that relied on the social behavior of humans. Like, for instance, you would recommend a movie to me that someone who's similar to me has watched, or a book that someone in my, I don't know, age group, background group has read, something of that nature. So I think that was known, but now in the AI era, I think it's even amplified.
Correct. Yeah. And in the AI era, we are coming into a very fine boundary with the depth of data that is collected.
Hmm.
Um, it just allows once you have so many data points
Hmm.
and the current system, especially based on deep learning and transformers,
Hmm.
once you have a lot of data in these systems, then you come into a domain where they might be able to recognize traits quicker, or yeah, they might be able to recognize deeper traits than even you are willing to admit. So we are coming into a very gray domain of how intelligent AI systems are getting, or how well they can recognize certain traits or predict certain traits.
Hmm.
Yeah.
Wonderful. Let me take the conversation into AI-based therapy. Now, I have done two studies on this, and it's fascinating. We did the studies on a chatbot that's not meant for therapy. It's called Pi. It's a very famous one. It's a social bot, but it can be effective in you can call it the active listening part of therapy, maybe the initial parts of therapy. And we compared therapy from therapy textbooks, very famous ones, and therapy produced by the interaction of the human and Pi. And the results were fascinating. A lot of professional therapists couldn't distinguish between which is AI human, which is human human. And we also did it with students. And again, it was the same result. Students couldn't, which students here represent the average person. And what was more surprising and more shocking is that on average, the professional therapists and the students rated the quality of the AI therapy as higher, slightly higher than the one produced in the typical textbooks. So, does that surprise you? And what can you learn perhaps in your entrepreneurship from these kinds of results?
Yeah, this is such a good example because if we look at especially the answer generated by modern Gen AI systems with LLMs, especially,
Mhm,
uh, they are so I would say the average output of these answers is so high quality
mhm,
that most humans cannot consistently compete
mhm.
with this level of outcomes nonstop. They can produce better answers, but sometimes you have a bad day and then
Of
you're
course.
tired, and then you will produce like less relevant answers.
Mhm,
Um, Something which I found quite like from a sociological perspective very fascinating is that in the early days of AI, we like there was a general acknowledgement that machines can do a lot, but they will never understand emotion or
mhm,
empathy.
mhm,
And one of the first use cases of ChatGPT by doctors
mhm,
was to give empathetic messages to their patients
mhm.
because doctors were so overburdened and so overstressed that they didn't have time to phrase
Exactly.
themselves correctly. And that's why they asked ChatGPT to write an answer that they could give to their patients.
Mhm,
Um, so it seems so counterintuitive 10 years ago to what is actually happening.
mhm, mhm, mhm,
The interesting thing, or the dimension that I will add on to it, though, is that I agree that in most cases they produce excellent output. At least individual answers are always going to be excellent.
mhm,
When it comes to the entire care trajectory,
mhm,
I would say they will always beat the average therapist, in
mhm,
my view.
mhm,
Looking at the coming years, we are consistently going to beat the average therapist.
mhm,
I think a much bigger problem or the a much bigger question that's going to come out is
mhm,
the question of accountability.
mhm. Yes,
So
from
the self
an ethical perspective.
exactly,
Mhm,
exactly. So I think the interesting debate to see here is that the self-driving car
mhm,
is going to be better than the average driver very soon, the
mhm,
direction it's going towards.
mhm,
But still, if you are in the car and the car is driving itself, but you were sitting in the driver's seat and this car crashes, the car doesn't go to jail. You go to jail.
because you have agency and AI doesn't have agency. Okay. But how about the ones who designed the AI algorithm? Maybe they should go to jail, no?
Great question. Great question. But this is the thing. Currently, our expected assumption is that if there is a car on the road, then
Mhm.
the one sitting in the driver's seat is the one who's and responsible.
Okay.
We take the same example and we put it into healthcare. If
Mhm,
an AI gives you bad advice, which results in significant health effects,
mhm,
who is accountable?
mhm, mhm, mhm,
And these are very sensitive, significant questions that we will have to answer in the coming years.
mhm,
On day zero, the way I'm trying to make sure we can bring innovation and progress uh, like today is by ensuring those who are medically licensed and are willing to take the accountability get the tools that they can treat 10 times more patients than they can right now.
mhm, mhm, mhm.
Because this helps everyone.
Yes.
The patients need care. There
Mhm.
are not enough care professionals.
Exactly.
We have a lot of the innovation that can
Right.
help in the underlying problem.
Ideally, we need one therapist per human, ideally. But that's, of course, we are extremely short-staffed in that regard. So I definitely see the potential of AI in that department. But I think if a therapist is listening to the conversation right now, and it doesn't just apply to therapists, I think it applies to many jobs, including mine, which is an as an educator. Um, what will the future hold? Are we going to be replaced by AI, or is that something you've thought about?
I would say that the future is a very broad term.
Hmm.
because timelines are very different.
Hmm.
I will say that if you look at the future where we realistically have an influence on, and let's assume this is between the 5 to 15 year timelines. Let's just
Hmm.
assume 5 to 20 years even. In this timeline, I do not believe AI will replace. If you look at healthcare, it's impossible that AI will replace doctors. That
Okay.
scenario will not happen in
Hmm.
probably our lifetime, but at least not in the coming 5 to 20 years.
Hmm. Hmm.
Um, what will happen though is that therapists and doctors using AI are definitely going to replace therapists and doctors not using AI. That will happen for sure because the level of productivity you get from AI tools is so strong.
Hmm.
The quality of your decisions on a broader audience gets so much better that this will definitely happen. But I don't think societally, we are so close to a social revolution where
Hmm.
we give up autonomy from healthcare professionals and give it to a system. Yeah.
Wonderful. Let's go over how AI can help the average therapist. Is it the admin tasks, for instance, booking appointments, things of that nature, customer support? Is it pre-screening? Is it initial therapy? How do you think AI can help the average therapist to be much more productive than how they are right now?
Great. So I think here AI also has a very broad use cases from
Hmm.
imaging to like pre-diagnosis to early warning.
Hmm.
And it's interesting to see like more and more use cases develop the broader the tech gets, the more advanced the tech gets.
Hmm.
Um, and I'll take the example that I'm working on right now, and I'll just connect these two together.
Hmm.
So the thing that I'm building at this stage is conversational voice AI agents.
Hmm.
So these are AI agents that can pick up the phone and do outgoing and incoming calls and can just start conversing naturally.
Hmm.
They can first ask you, hey, what is your date of birth? To make sure that they know the right person is on record. They can inform you about upcoming appointments, but they can also do questionnaires. They can ask you 10, 15 questions to not only one by one,
Hmm.
in very free form text. So, how are you feeling can map to an underlying questionnaire if needed. And these agents are pretty complex.
Hmm.
If you want them, they become receptionists. And if you make this decision tree broader and broader, they can take over bigger and bigger parts of the conversation. Uh, Apologies. I had a low battery warning, so I'll
No,
plug my
no,
phone
no worries.
in.
That will be edited
uh,
out. It's not a problem.
Great, great. I just plugged this in. Um, so if we look at this on this conversational voice AI, I'll bring back to the topic.
Hmm.
So with conversational voice AI, we can cover as complicated flow of conversations as we want, from scheduling appointment to questionnaires to becoming a full receptionist if needed.
Hmm.
Um, Now from here, if I try to map the future that I would want to see,
Hmm.
and the use cases that AI will eventually go forward and take over.
Hmm.
So, in my mind, the reason I started building this from a social first perspective is that coming from Pakistan, from a lower middle class family, I can see the world. We all know this as well. The world is not fair. We all know that there is a lot of inequality and
Yes.
bias around the
There
world.
is those who have and those who do not have.
I think this is something you would know even better than I do. Like
Yes.
it's the our backgrounds have resulted in us at least understanding this truth
Hmm.
and embracing it very deeply early on.
Hmm. Hmm.
And one of the things that excited me with this conversational voice AI as an underlying technology is how it flattens the levels the playing field.
Hmm.
What happens with voice AI once conversations become a true medium for input and output and interfacing with a computer
Hmm.
is that now suddenly you do not need to understand how a computer works to be able to use the software behind it.
Hmm. Hmm.
Because even if you're illiterate, even if you don't know how to use a computer,
Hmm.
you can just pick up the phone and call a number and start interacting with it.
Exactly.
This is a paradigm shift. This means that if you needed a customer management system, which only 100 million people or a billion people in the world know how to use, then the remaining 7 billion who don't have access to Salesforce can
Mhm.
now just pick up a phone and say, like, hey, I just bought 5 bags of fertilizer.
Mhm.
And the AI can register it into this voice-based customer registry system.
Mhm.
So, in my view, conversational AI is a huge power to leveling the playing field. Now, if we take this and if we map it to healthcare, because healthcare and education are two fundamental fields where the
Correct.
playing field is really skewed, and
Yes.
that's where I want to like tackle as deeply as I can.
Mhm.
Um, and if we look at it in healthcare terms, so the idea that excites me the most is with current technology, the direction we're taking, we can very easily set up a phone line in
Mhm.
countries in Africa, in country like Pakistan,
Mhm.
where anyone who is illiterate can pick up the phone and say, "Hey, I have a pain in my foot.
Mhm.
What should I do next? Where
Yes.
should I go?"
Yes. 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 Yes.
And the AI can give at least lifestyle advice, or if not that, then at least tell you walk 30 minutes to this village and there's a USAID office which is gonna be able to help you in some form.
Mhm. Mhm. Mhm.
Now, this is fundamentally on a societal level extremely powerful. And this is
100%.
what
Yeah. You
energizes
are
me.
increasing access to services. Yeah.
There you go. And this is what energizes me the most. And now that I can see this as a potential outcome in a very cost efficient way in the coming years,
Mhm.
I'm trying to find the path towards it in the coming years. How do I keep building towards this future and make it a reality?
Mhm.
And this was a long winded answer, but if I bring it back to healthcare and the
Mhm.
value it generates there,
Mhm.
my vision on this, and having done a mental health, we're going to be a medical device.
Mhm.
My previous app would have been eventually a medical device in Western Europe. So,
Mhm.
same level of certification as a microscope, for example.
Mhm.
Um, I think the paths to take towards it is step zero
Mhm.
is removing administrative overhead.
Yes.
Uh,
Exactly. Exactly.
we have a
Also
shortage of
access
healthcare staff.
access to medical advice. I think, as you correctly said, I think the internet helped a little bit in that regard, but the advice is not personalized. Now AI can give personalized medical advice.
Exactly.
Mhm.
Exactly. They can be really, they understand you and can
Mhm.
give you really tailored advice. If we look at these advanced economies where we're living in, where there are more resources, I
Mhm.
think one thing we all see is that there is a huge shortage of healthcare workers.
Yes.
Uh, Europe alone, 1.6 million vacancies for healthcare workers
Oh
this
God.
year.
Wow.
And with current measures, by the way, and the current measures, I mean, we used to spend 8% of our GDP on
Mhm.
healthcare in Western Europe. Now we spend 13% of our GDP.
Oh wow.
In the last 25 years, we have gone up 5% of the GDP, and we still have 1.6 million vacancies,
Mhm.
which will touch 4 million vacancies by
Mhm.
2030.
Mhm. Mhm. Is it because the population is increasing or the elderly, the number of elderly is increasing?
It's on both fronts. We
Mhm.
have a graying population.
Mhm.
On the other side, we do not have enough skilled workers,
Mhm.
from nurses to healthcare professionals.
Mhm.
And on the other side, like people expect, like more and more people have need for better healthcare, from mental health to physical health.
Mhm.
Uh, so the problem won't solve itself. There is at this rate, it's just getting worse every year.
Yes.
So we need innovation today for this to work.
Exactly. Exactly.
And if we look at something that can be done today through current conversational voice AIs alone,
Mhm.
is removing admin overhead.
100.
So we pick up the phone, we schedule the call, we make sure questionnaire and NPS surveys are done,
Mhm.
we remind patients about upcoming appointments.
Mhm.
Uh, Only reminding patients for upcoming appointments
Mhm.
results in actually roughly millions of euros in the Netherlands alone in losses.
Wow.
Because our nurses are spending almost 20 to 40% of their time picking up the phone and calling patients.
Mhm. 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 Yeah,
And this can
this
be
free time can
resolved
be used for something else more important.
for actual care, for actually providing one-to-one like care that the patients need. Uh, so from an admin standpoint is where I'm trying to tackle the problem on day zero.
Mhm.
If we take the steps of where this leads, is that first we tackle admin where taxpayers save money and access gets better
Mhm.
within the next year and two. In this timeline, once we have done roughly a few million minutes of conversation, we also have evidence to prove to national healthcare bodies that this system can follow guided conversations correctly. That's the stage we take from purely admin to the next step, which is lifestyle advice,
Mhm.
non-medical lifestyle advice.
Mhm.
Once you're able to prove that it can do non-medical lifestyle advice correctly, now you start going into, I would say, even basic mental health. So it's well-being health,
Mhm.
not even like the diagnosed mental health, but well-being health.
Mhm.
And from there onwards, we have a clear path in the next 10, 15 years to be a doctor's assistant. So
Mhm.
they do much, much more, even certain to a certain degree on some medical questions.
Mhm.
Um, all of these, of course, supervised, but looking at these paths, I think what we need to do on day zero is not resist these change and
Yes.
understand the administrative value or taxpayer money that can be saved today already through such systems.
100%. Okay, so you definitely convinced me about the potential of AI in healthcare in the future. I think the benefits cannot be ignored at all. These are amazing benefits, and it seems like people all over the world can benefit from it. But there are still challenges, and maybe this is something we can end our conversation on about the challenges of AI in healthcare. I think there are questions about privacy. Who owns the data? Do I own my own data, or does the provider own the data? There are questions about accountability, which you brought it up earlier, but not in a healthcare context. There are questions about bias, I think. Is the AI algorithm biased? So I don't think we have the answers to all these questions yet, but any insights you have would be highly useful for our audience.
Definitely.
Mhm.
So I think first and foremost, where do the rules come from? There have to be rules to play with. And these rules have to come from, I would say, the people who are most concerned with the public welfare.
Mhm.
This is why I'm actually a fan of, in a large degree, to European regulation as well, in Europe alone, that we need to have strong foundational rules coming in that define how, in what setting can you work with healthcare data and not. When it comes to AI, we already have a lot of rules that apply to it.
Mhm.
So when it comes to admin, our device is currently validated for the upcoming EU AI Act. It's validated to be a medical device in the coming 2 years.
Mhm.
So there are regulations on I would say national or government level, basically, which we have to be compliant with. These rules have to be clear, and I would say the hospital should just hold everyone accountable to these rules. And then you don't have to think again about the same issue. So when it comes to how does this work, I would say there are stronger national rules or EU-wide or US or in UAE as well. We have rules, and the national body should define these. Then it comes into the scenario of how does this work in practice? Like, where is the hesitation coming from? Um, and I think this is where, because if we remove the compliance issue and if we offload it to the government and their regulation, there is still a ton of hesitation. Most doctors and also on the other side, people are all concerned that this is new. We do not understand it. How
Mhm.
do we go about it in an ethical manner?
Mhm.
And I feel one thing that is very crucial for us to understand, especially as we are on the edge of innovation, we're really on the barrier of innovation in healthcare, is that if we don't find methods of sustainably and accountably trying to build this innovation ourselves,
Mhm.
we will eventually run into healthcare crisis where we would need short-term solutions.
Mhm. Mhm. Mhm.
It's the same thing as, oh, for example, in climate change, that if you do nothing about it, eventually we will need to cover the skies more with clouds just to shield ourselves from the heat. And we
Mhm.
don't know how bad that solution is,
Mhm.
but that's like putting steroids on our body because we didn't work on healing our body in the whole time that we have, like all the time that we had before this.
Mhm.
So and these are things that I will say, if I look at Western Europe, there is strong moral ethical values. But then when it comes to application, we're much more hesitant.
Mhm.
And we don't believe in the gig economy. of freelancers that Uber has employed, but we didn't find solution to the problem of people needing temporary stay, which is where Airbnb and Uber won the landscape, and now they define the rules because there's a clear need for it in the market.
Mhm.
So it's a weird way of connecting it, but I do strongly feel that if we stay paralyzed and hesitant of not taking decisions today ourselves,
Mhm.
then those decisions will be made for us,
Mhm.
and we will not have a choice. We just have to agree to those decisions.
Wonderful. So you're calling for a global effort, I think, in terms of regulating AI systems, especially healthcare AI systems, according to the ethical principles. Now, we have standards by IEEE, the EU, the UNESCO, they all have standards for ethical AI, but we need a strong global effort when it comes to regulating AI systems. But when you say if we don't move fast, then we'll have to accept the terms laid out by others. Who do you mean by others? Like, do you mean the big high-tech companies, or what do you mean by that? Yeah.
I mean, eventually, if there is an opportunity that's big enough, there are always going to be private players who pounce on them.
Mhm.
That is just the way things have happened in the last 50 years, I'd say, even 50 to 100 years.
Mhm.
Um, and when it comes to moving fast, I'm not saying that it has to be on one side either a global collaborative effort.
Mhm.
I'm just saying all of the countries around us have strong education institutes, have
Mhm.
strong hospitals, have innovators.
Mhm.
So, in each country where we're seeing the value this innovation brings, let's
Mhm.
just make a small group. The leading innovation institute of the country, the leading hospital of the country, and the leading ethics principle for AI, whoever is in charge in that country. Let's
Mhm.
make a small group of these three teams together and go like, let's start a pilot from January with like 0.01% of the population to
Mhm.
see is there any value here and
Yes.
what values do we stand for. If you don't try and learn from it quick enough, you
Mhm.
just let others decide the values.
100%. And with that, I end our conversation today. It was a huge pleasure. Thank you so much, Omar.
No problem at all. I'm glad to be here.